earth are you doing?
Well, it worked last night.
Well, it's not working now.
No, I know. Here. No. Dance. Just dance. So, no. No, I'm sorry. I think it's actually making me
All right, you
worse.
take him.
Hey, stir the baby. Stir the baby.
Hello. I'm afraid I'm going to need those.
Martin. I've been thinking, and I want to move to London with you. Well, we're going to move to London.
Right.
Oh. Just right?
No? Good.
Good. Martin! No, sorry, get him out of here! Martin! Oh, no! It's all right, it's okay. It's okay.
This belongs to you.
I don't want it.
Bad luck, you've got it. It lives here. Used to belong to Joan. It smells. And if it sneaks into my house and hides once more, I won't be responsible for my actions. So,
Well, maybe it might prove to be of some use as a guard dog. Some shifty young man decided to liberate the hubcaps from my car. I've lived in London for 25 years and never had so much as a whisper of trouble.
I shouldn't worry about it. A lot of the people who live around here are drawn to shiny things.
I once consulted a case at Broadmoor where the patient had eaten all the cats in the neighbourhood. So, in the wider scale of things. Even so, I'd rather not wait to find someone removing my light fittings or God knows what else. Does it have a name?
But, no, call it what you want.
Dr. Ellingham. Oh, Ellingham's.
Ruth will suffice.
How are you then, Doc? Come up here to get away from all the crying then?
He says good morning.
Oh.
Well, you've missed all the excitement. I had a visit from the local hubcap thief this morning.
Well, what do they look like?
About your height, longish black hair, no missing limbs or other identifying characteristics. Disappeared in that direction.
Well, the Dunnitches live up there. Most likely Michael. He's lived up there alone with his mum for years.
Well, it's a bit old to be living at home.
Well, there's always been an odd one, that one. I live at home.
Yes, well, I can't spend all morning nattering to you, not while I'm paying you by the hour.
Well, yeah, I was thinking about that, about my hourly wage.
No.
Right.
You crack on. I'm going to say hello to the neighbours.
Sorry, Doc. I know I'm late, but it's a one-off.
It's your first day.
Yeah, and my granddad was supposed to wake me, but he never...
Get an alarm clock.
I will buy one on my lunch break. And when is that exactly?
You've taken it. If you're going to be late tomorrow, don't bother coming in. Put the next patient's notes on my desk. Is there any way you could keep the noise down?
Yes, no problem, Martin. I'll just flick the switch on the back of his head that turns him off for an hour or so.
Well, it's just not ideal when I'm trying to hold surgery. Perhaps you could take him for a walk.
You're telling us to get out of the house?
No, not at all. But newborn babies find the feeling of motion soothing. It's a fact.
Yes, of course. It's not you wanting us out. No, it's a fact.
You should send in your notice at the school, if you meant what you said earlier.
I did, yes. I've already written my notice. I just need to post it.
Good time to go for a walk.
Come on then, Albert.
Albert.
Can't just keep referring to him as the baby.
Yes, but Albert.
But he needs a name. Stephen, Paul, Michael, Elton, whatever. I imagine you have patience waiting. Don't worry, we won't be in your way.
Want here?
Good morning.
This is private property.
And it's charming. I live at the farm next door.
Oh, you don't. That's Joe Norton's.
Yes. And I'm her sister.
I haven't seen her around for a while.
Hadn't you heard? She died.
Oh. Yes, of course. Poor Joni. You must be her sister.
Yes.
I left the kettle on. Joan pop round with some veg sometimes. Crates of the stuff. Yeah, grew it in her garden. And eggs sometimes. But we never ate any of it. Well, you can't trust other people's food, but you know that.
Yes, that can be a problem sometimes.
And it's not just the food. It's what they think. Sometimes it's just not very nice. Oh, sugar? Oh, please sit down. I wish I could have offered you something else, but Michael still hasn't gone down the shops. He's too busy creating. Oh. Actually, his food is something horrendous. I have stomach cramps most days. I suppose that's the price of genius.
You should get a checkup.
Why?
For the stomach cramps. Oh. Is your son here?
Why do you want to know?
Well,
I don't think that's any of your business.
No, of course not.
Years he's wasted on his art. Doesn't have a job. No, but he thinks he's going to be another of these great artists. Vincent van... Sometimes I don't think he's quite right in the head. He gets that from his father, wherever he is.
When did his father...
Oh, have another biscuit.
That was a gunshot.
Oh, yeah.
Those are my hubcaps.
Are you sure? Michael's always finding things.
He found them attached to my car. And now I'd like them back. Right then.
He says they represent something or other. I forget.
Probably the fact that I'll be driving around with ruined hubcaps. Lovely to meet you.
Benign paroxysmal positional vertigo.
Bet you can't say that 4 times in a row.
The spitting sensation, the feeling of nausea, rotatory nystagmus. The eye is rotating towards the infected ear.
Felt like seasickness.
A bit, yes, it is. Calcium crystals in the canal fluid of the inner ear become dislodged, but affects the balance mechanism.
Crystals and canals in my ear. The next thing you'll be telling me is that I got a magic castle with a fairy princess up my nose.
Why's that?
It's my first day. Can you call back later? All right. Okay, thanks.
Morning.
Hello.
Morning, Stinky.
I'm mad at you. You said you were going to wake me.
Oh, sorry, love. Got lost in the land of Nod myself. Won't happen again. Any chance of slipping an appointment in for a decorated war hero?
Go on then.
So I just need to take these pills in?
Yes.
But what if I go on a boat? Because if I got seasick on a boat and had this ear thingy, will that make it worse, or will the two of them just cancel each other out?
Are you planning to go on a boat?
No.
Go away. Next patient.
Mr. Newcross.
Mr. Newcross. Come through.
You probably got a good reason for being late. You're a receptionist. I have to say, I've heard nothing but good things about that young lady.
I know she's your granddaughter.
Right, yeah. At my age, you get a bit forgetful.
Take a seat.
Oh,
What seems to be the problem?
well, my elbow's fine. So thanks for that, Doc.
And what's the problem right now?
Getting old, Doc, that's the crux of it. The body starts rebelling, can't do the things you enjoy no more. I love a good walk, see? The French have a word for it.
What's the matter with you?
Flat earth. One who experiences life by drifting through towns and cities. Well, I'm buggered for that now. She's a real beauty.
Bunion. A sign of skin decay. You need a course of antibiotics. And an x-ray of the metatarsalphalangeal joint to screen for anything else. I'll get the receptionist to make an appointment at the hospital for you.
And she'll get right onto it, Doc.
Louisa! Pippa, how are you?
Oh, more importantly, how are you? Oh, is this her?
Him.
Oh, I can never tell at that age. Oh, he's a little prince, isn't he? How are your nipples?
Sorry?
Mine were killing me with the twins. Cabbage. Stick it in the fridge, tear off some of the leaves and wrap it round the, you know, like a little bib. Works a treat.
Okay, thanks.
With all the trouble they put you to, it's funny to think the worst part is going back to work. Just you wait.
Oh, I'm not looking forward to it. Although I'm only going to be there till half term. We're moving to London. This is my final notice.
Oh, no. Oh, I have to have a drink before then.
Yeah.
I mean, we'll probably just sit there and blather on about babies and whatnot, but at least we can do it over a nice bottle of wine. Tomorrow night, then?
Okay, yeah.
Right, yeah. Home to feed the family. Oh, I envy you, only one. You don't know how lucky you are. Tomorrow, then.
Yeah, see ya.
See ya.
I've been having these pains, Doctor, in my belly. They're getting worse. Your aunt suggested I come see you.
Any diarrhea?
No.
No.
How long have you been having them?
Well, it's been about...
Mrs. Dunwich.
She won't remember.
Could you wait outside, please?
Can't do that. She needs me in here with her.
Has she been declared incompetent?
She's fine.
I'm fine.
Be quiet.
Sorry.
Not you.
She says she's fine.
Out. Now. Shut the door.
I don't trust him anymore. I think he wants the house to himself.
How long have you had the abdominal pain?
I think he's planning to do something to me.
I see.
He has this look.
Anything apart from the look?
He has thoughts. Dark ones. All the time. You write that down. Dark thoughts.
I'm going to give you a test.
Will it find out what he's up to?
I'm going to say 3 words, and I want you to memorize them.
Oh, all right.
Apple, orange, pear.
I've got that.
And take this and collect a urine sample, and when you come back, I want you to tell me what the 3 words were.
What do you want this for?
I need to check your kidney function. A kidney infection could cause abdominal pain and a confused mental state.
Oh, is that likely to happen?
It's something to look out for, yes.
Right. What's there?
Yes.
Orange.
How cheap was this?
We're saving 60p a bottle compared to the old house red.
I suppose if nobody buys it, we can repackage it as fragrant paint stripper.
It's not that bad. It's an acquired taste.
Ugh.
It's like the finest wines.
There you are.
Can you remember the 3 words?
Why are you testing her memory?
I'm concerned about her state of mind.
Well, she came to see you about her stomach.
And she's displaying paranoid behaviour.
Don't you get involved.
I'm her doctor.
You leave her alone, and we'll be fine. Do I make myself clear?
Are you threatening me?
Don't you speak to my boy like that.
What?
He's worth 100 of you.
Would you take a seat, please, Mrs. Dunwich?
I'd rather die a death. Come on, Michael.
Yes, Mum.
All right, Grandad?
Fish supper waiting for you. Oh, apologies for dropping you in it this morning.
Are you trying to win me over with a bit of cod?
No, cod and chip.
You're nuts, you are. Let's save the fish for later. Got to grab my purse and go get an alarm clock. Otherwise, Doc will go spare. And I would like just once to have a job that doesn't end up with me getting told to sling my hook.
Well, I can help you with that. You just need a bit of get up and go. I miss you.
Yeah. Thought it'd been at least 2 minutes since you mentioned the war.
Alarm clock's on me, eh?
Oh, cheers.
Louisa. Louisa. The baby.
There's someone in the house.
What on earth are you doing?
Morning, Doc. I'm here for work. He's got quite a pair of lungs on him, hasn't he? Better than any alarm clock.
It's 6:30 in the morning.
Yeah, I know I was going to make a start on sorting through the patient files. Then I heard the little fella kicking off, knew you'd be getting up. And
Go away.
first you say I'm too late, then you say I'm too early. Make your mind up, Doc. Morning.
Morwenna, I'm sure Martin appreciates your enthusiasm.
No, I don't.
There are boundaries.
Oh, I just figured because you're probably up and about, you might like a cup of coffee. Do as I do. Start the day with a strong brew.
Shut up and get out.
See ya.
Don't suppose you'd like to feed them while you're over there? Something about their beady eyes, their arrogant little beaks.
You're lucky they're still here. Someone's taking your hinges.
Why would someone want to do that?
Why would someone want to take your hubcaps?
Oh, you think it's Michael?
Do you want me to go up there? Have a word with him?
No, you concentrate on mending the chicken run. I can deal with the neighbours myself.
Your art is rubbish. You'll never amount to anything. You know.
What have you done? In here, Martin.
She did it herself.
Do you know where you are, Mrs. Thing?
I'm ever so sorry, Doctor. I wasn't watching where I was going.
Can you sit up?
Ma'am,
Oh, that's it.
you don't have to look at me like that. It was an accident.
Follow my finger.
She regained consciousness just after I called. I need to talk to you privately.
She walked into the door when I opened it.
And did you help her walk into it?
She wasn't paying attention. Now, Mum, would you like a scone? Because I just baked a fresh batch.
Oh, no, thank you, Michael. I'll be fine, sweetheart.
I think we'll let Martin decide that.
Will you all be quiet, please? You're not concussed. And that wound won't need stitches, but I'll disinfect it and dress it.
I'll do that.
No, you won't.
I know how to do it. I'm not stupid. The red's okay. You can leave now.
Any more abdominal discomfort?
Enough now. She needs a rest.
Michael, please.
Fine. Finish your business.
And the stomach pain?
She's being fine.
No, really, I have been. Might need a new pair of glasses, though. Silly old cow that I am. Ow!
What did you make of them?
Well, it wouldn't be the first time a mother and son had come to blows. It is a strange setup they have.
Well, this is Cornwall. But even so, there's obviously some sign of mental impairment.
Or early dementia.
I'll see if I can speed up her referral for a psychological evaluation and chase up her urine analysis and toxicology.
And I'll cross them off my Christmas card list.
Bert?
I lost my sea legs, Doc.
Do you take those tablets I prescribed you?
I was going to start today.
Well, get up.
I don't know whether I can.
Oh, God.
Get a room, you two. Grandad's got a rabbit to cook for tea. Does anyone know any nice recipes?
Well, I like to.
I've never cooked one before. I could make it into just a stew, I suppose, with veg and that. I could fry it up. They're not rodents, you know. Some people think they are. They're actually game, which doesn't mean they're up for anything, although they do like to shag a lot. Old Mr. McIntyre here needs his rash looking after, ick. And don't forget he's going to need a new prescription for that stuff I can't pronounce. This lady here has a bad back, thinks it could be a slip disc or possibly a trapped nerve, and this gentleman...
Shut up.
It's getting bad again, Doc.
Come in.
Who wants tea and cake?
Sit down. On the floor.
What?
On the floor. Since you didn't have the good sense, let alone the good manners, to take the tablets I prescribed you.
It was a new house red, Doc, that I was trying to make work
Be
for me.
quiet. You're going to have to perform the Epley maneuver. If you do it right, it'll reposition the particles in your ear, and you won't have any more problems. The symptoms were in your left ear, so turn your head to the left and lie down. Remain like that for 5 minutes, and then turn to the other side for... No, wait, remain like that for 5 minutes, then turn to the other side for a further 5 minutes.
Am I meant to be remembering this, Doc?
Yes. Further 5 minutes in that position, then sit up straight for 30 seconds and you should be fine. For goodness sake!
One more time through that, Doc.
What are you doing?
Sorry, making too much noise. Well, I was going to arrange a leaflets, medical magazines and journals, and then I decided it might be fun to make a cake for the patient. Then I saw all the pots and pans and stuff, and I thought I'd give him a good clean.
How many cups of coffee have you had?
Just the one. Although I did have a hot chocolate as well. Mint. Some people can't stand the flavoured ones, but me, I love them.
Have you had an energy drink or caffeine tablets?
Apparently, right, those drinks dehydrate you.
Stop talking, look into the light.
Why?
Just turn your head. Your pupils are dilated. Mydriasis. Caused by illness, trauma, or drug abuse. Have you been taking drugs?
What are you saying? I don't take drugs.
You banged your head recently?
No. Well, I did take a couple of pills. They weren't drugs, though. What are you doing?
Accelerated heart rate. You're fired.
What?
You've been taking stimulants.
Oh, I've taken energy pills.
Amphetamines, more like. It is totally and utterly unacceptable.
I hardly think that's a sackable offence. Come on.
You didn't think that taking amphetamines before coming to work in a doctor's surgery was a sackable offence? Really? Bert. Wake up.
Doc.
The Epley manoeuvre.
What are you doing? My farm is not an art supply store.
Mum said it'd be okay.
I very much doubt that. Fine, take them. I'm too old and too dignified to stand around arguing about chicken feathers. How is she, by the way? Your mother? Feeling better?
She's great. No need to bother us anymore. She says hello.
Mrs. Dunnage? Hello? Shirley? Shirley? What's happened to you?
He's killed me.
Doc, caught me in the middle of a surveillance operation.
Penhale, I'm looking at the results of a urine analysis on one of my patients. There's a high concentration of arsenic.
Arsenic? Do you have a case of poisoning? Haven't had one of those in a while. Never, in fact.
Listen, I think the son is trying to kill the mother. It's the Dunnage family at Cliffside Farm.
Roger that. Thanks, Doc. I'll take it from here.
No, you won't. I need to go to the chemist to get some dimercaprol, but I'll meet you there. And Penhale.
The son is possibly deranged and has a firearm.
If I get there first, I'll wait for you.
Oh. What you doing here? Who are you?
It's Ruth Ellingham, dear. Shirley?
He's poisoned me.
Your son?
He put something in my food. Weed killer. I'm dying.
Well, let's not be premature. I'll get help. Is there a phone up here? Or only downstairs? Nothing to worry about.
Put that down.
Hello, Michael.
You're here. Again.
Yes. I was concerned about your mother. I'm sure you are as well.
There's nothing wrong with her, so there's no need to take her away.
I think she might be ill, Michael.
She's always complaining.
Yes, I've noticed that too. Must be very painful for you. You know, since I've moved here, I've seen so many guns. Everyone seems to have one.
You need him for the vermin.
What kind of gun is that? Do you think it would be too heavy for me?
Huh?
Well, rats are getting at the chickens' eggs. Can I?
I don't know about that.
Okay. I just wanted to see what it feels like. Knowing me, I'd probably shoot the chickens and miss the rats.
I've got to warn you, don't you go pointing that at anyone. It's loaded. Ma'am?
We should help her, Michael. Shouldn't we?
What's the matter, ma'am? Ma'am? Is she dying?
You won't be able to manage without me, will you? It's just the thought of that.
Don't say that.
You poison me, you murderer.
No, ma'am. No, ma'am, I wouldn't. Why would you think that?
She's delirious. She doesn't know what she's saying. She needs water. Michael, could you get some water for your mother?
I'm not drinking any of it. He'll put weed killer in it.
I wouldn't. I wouldn't. Even if I did, the weed killer's not even...
Even if I did? That's practically a confession.
Just hurry, Michael. Go on.
Get me out of here.
I'm working on it, but we must keep calm. Now, is there a phone up here?
No.
A mobile, then?
I think it's in my handbag. Over there.
Oh, just like me. Never throw anything away. I think your son is repenting, dear. His fear of losing you is somewhat greater than his desire to kill you.
Why are you saying that?
There! See? Weed killer!
If you planned to poison someone, you could at least try and be subtle about it.
No! Look, Mum, it's harmless. It's not...
Michael?
Mum?
Over there!
What are you doing?
No, Michael!
All right. Not ideal, but we can work with it. Now, you watch him while I go and...
Stay there! I mean it. Not another move.
Doc, let's not be hasty. Caution is 9/10 of what it takes to stay alive in a potentially explosive situation.
You left your lights on.
Don't hate me, Mum. I'll be good, I promise. I'm your best little boy. Just give me another chance.
Oh, show some dignity, man.
Hello? It's Dr. Ellingham.
In here, Doctor.
No, Martin!
Head's quite a bit better now, Doctor. Thank you.
Glad to hear it.
Whoa, gun.
Get in here, you! Over there! Go on.
Now, Mrs.
Dunnage.
Yes. You're confused, which is understandable. You've absorbed a huge amount of arsenic. You should be dead, really.
Oh, so now you're on his side.
Doc, leave it to me. I'm trained in the art of hostage negotiation.
Nonsense. I see you couldn't avoid getting involved.
I was trying to help them, Martin.
Everybody be quiet. I'm going to shoot the next person who talks.
But I'm innocent, Mum. Believe me. Why would I want to hurt you?
'Cause you're lazy. You want the house. You're just like your father.
No, Mum, no. I wouldn't do anything to hurt you, please.
Stop whining.
What you doing? Put that down now.
Oh, for God's sake, what do you think I'm going to do? Throw it at you and hope you swallow some? Non-toxic, pet safe.
And it's biodegradable.
Shut up. No arsenic. It's harmless.
What about my stomach pains? That doesn't prove anything.
What it proves, dear, is that Michael hasn't been poisoning you.
He told you, Mum.
There's a peculiar odour in this room.
I'm afraid that's the smell of murder, Doc.
It's like garlic.
And French cooking.
I think that it's copper arsenate, and I think it's coming from this disgusting green wallpaper.
What? Which is lovely, Shirley.
They used to use arsenic as a pigment in wallpaper until they found the fumes it gives off kill you.
Fumes? No, you're lying.
No, I'm not. It lies dormant until it's disturbed. How long's this wallpaper been like this?
Yeah, I started stripping it about a month ago.
Moocher doesn't finish anything.
And the abdominal pains, did they start about then?
I don't know. Maybe.
And I assume that the paranoia started then too.
What?
The arsenic has affected your mental capabilities, Mrs. Winchelsea.
I told you it wasn't my fault.
Well, if you finished what you'd started, none of this would have happened.
Maybe now would be the time to put the firearm down, Shirley.
Rubbish. I'm not falling for that. Poisoned by the wallpaper.
Leave it to the professionals, eh, Doc? Now then, Shirley.
What are you doing?
Taking control. I'm a busy man, Shirley. Can't spend all day nattering with you. We both know that the gun isn't loaded. So why don't you be a dear? Just hand it over.
Oh, I hate it.
You idiot!
I never expected that to happen.
Here, not you. I'll give you something to counteract the effects of the arsenic.
What?
Dimercaprol. It's a good thing, unless you want to continue feeling ill.
Good work, Doc. I distract you, you get the gun. Textbook stuff. Good work, people. Pats on back all round.
You all right, Mum?
Yeah.
Yep, up a step.
All right. You have no right to send her away. I need her here. I can take care of her, you know.
Your mother needs to go to hospital. She will recover. And as soon as she's discharged, you can pick up your dysfunctional relationship where you left off.
Well, no thanks to you.
What? Unbelievable.
Is he actually a policeman or just pretending to be one?
Ellingham? What? Right. I'll try and get him onto his side and keep him warm. I'll be there in a few minutes. Patient.
Typical slacker. Do anything to get out of mowing the lawn.
Got me back to rights, love. Lying down on the job.
Doc will be here soon.
Good. He needs to be set right. He shouldn't have sacked you. I want to give him peace of mind.
Grandad?
Oh, Wenham.
Grandad, please. Grandad? Oh, no. Please. 1, 2, 3, 4, 5. Count, please, Grandad. 11, 12. Don't you dare leave me. 1, 2, 3. You just keeled over, Doc. Do something.
Right. Can you hear me, Mr. Dunwich?
Yeah?
I've called an ambulance. When did his breathing get bad?
I don't know. It seemed like forever. A minute ago, maybe. Is he going to be all right?
His pulse is stable. How did you know to do CPR?
I saw it on the telly.
Do you have any aspirin?
Yeah, I'll go and get.
Doc.
Yes?
If you don't give the child her job back, I'm going to be waiting for you at the gates with a big stick.
You've just had a cardiac arrest. You're in no position to threaten me. Did you feel any pressure in your chest or pain before it happened?
Oh.
Jaw? Your left arm?
Oh, it's been fine.
He's been overdoing it. Scampering about all over the place since he started taking these energy pills.
What energy? Well, show me these energy pills. Are these the ones you were taking?
Like army pills or something. Grandad found them in his old stuff. See? Definitely not amphetamines.
That's exactly what they are. You've both been taking methamphetamines.
Yeah, but they came from the government, didn't they, Grandad?
Yeah.
They used to hand them out to soldiers in the field during the Second World War to keep them going. They're not meant for geriatrics and teenagers.
I was just trying to help.
You've given yourself a heart attack and lost your granddaughter her job. That's really helpful, isn't it?
Doc, she didn't know. She deserves a second chance, don't you think? She's a good girl.
Well, that remains to be seen. Sit up. Take this.
Oh, thanks, Doc.
Here's some water.
All right.
How do I look?
Bit flushed?
Oh.
Pulse is fine. Regular.
Suppose that's the closest I'm going to get to a compliment. Me and my regular pulse. Feels all wrong. Going out and leaving the baby.
You've nothing to worry about. Apparently, I have some medical training.
Make sure you check if he needs changing. Oh, and read him a bedtime story. He seems to like the one about the talking fire engine.
Highly unlikely that he can grasp the concept of a fire engine, let alone one that's apparently sentient.
Studies have shown that talking to infants can help develop their cognitive skills.
Yes, to a certain extent.
Bye.
This is an article by a Dr. Henry Wolfstein of the need to focus on cytotoxic therapies for cancer patients. There's a picture of Dr. Wolfstein there. Patients with advanced liver cancer who had not previously received chemotherapy were randomly allocated to 3 different regimens, representing minimal, conventional, and intensive cytotoxic treatments. Patients with impaired renal function were excluded from the analysis, and results were stratified according to risk category, based on retrospective analysis of previous studies. Results support the conclusion.
Hello? Officer in need of assistance.
And some trousers.
Who are you?
I'm Eleanor. His grandmother. Lulu.
What are you doing here?
The IRA have long used Semtex in their bombing campaigns against Britain. Since 1986, this Semtex has been supplied by the Libyan government. Our new current affairs programme Exposure starts with Gaddafi and the IRA at 10:35.